Alright, so guys, a new week means a new video. I'm the MDC and MDCRX, and if you've been following up on the post here on Instagram, you know that today we're going to be talking about oral health versus COVID-19. Also, if you've been following up, you know that I'm having a special guest today, Mr. Wade Edwards Green. So for today's video, I'm just going to let him take over the entire video because I know I'm tired of hearing my voice. So I'm just gonna let him take over the video and introduce himself, sharing some tips and some information about the relationship between COVID-19 and oral health.
Hey everyone, I'm so excited to speak to you today, but first and foremost, Mishka, thank you so much for having me. So the topic for today is oral health, looking at just some views of oral health, but also the relationship between oral health and COVID-19. So, just a backstory in terms of who I am and my professional background to give a better understanding of the approach I will use in discussing COVID-19. So first and foremost, again, my name is Wade Edwards Green, and I'm the co-owner and the managing director of the two dental offices in Jamaica, Melmac Dental Care in Crossroads and Highgate Dental Care in St. Mary. I'm also a certified IIN health coach, and I own and operate a healthcare platform called Green Health 360, which basically connects a community of health and wellness experts to individuals who are on different aspects of their journey in terms of improving their overall health and well-being. Outside of that, I do health administration and informatics in Jamaica, the US, and Portugal, and I also do some practice management consulting. Why is all this important? I will be speaking about oral health not just from a clinical perspective in terms of dentistry, but also from a holistic perspective, which is the area of Green Health 360 and me being a health coach, to provide a multifaceted approach and perspective on oral health as a lifestyle, as well as how that can also be impacted by COVID-19. However, it's important to note that at the end of the day, everything that I'm stating is actually based on what the research suggests. We believe in evidence-based practice, so we follow the most current research and what that shows us. And until there is more research, that is the practice that we follow in terms of the suggestions that we give and the lifestyles that we promote. So we know that oral health is of critical importance to the body. Oral health and systemic health, or your body's overall health, are critically connected. What happens in the mouth impacts the body. What happens in the body can also impact the mouth. So looking at the oral health, we know that the mouth is an important entryway for the body, and we have different bacteria of the body, but they have different impacts based on where they are. We look at dental plaque, for example, which is basically a matrix in the mouth which is made up of saliva, food particles, as well as bacteria. So things get trapped in it and create this matrix that can pass through the bloodstream and go to other areas of the body. It can be ingested, which means it goes into our digestive system, or it can be aspirated, which means it goes into our respiratory system, through our lungs. So in many instances, we can see how we see that oral health has an impact on the body in terms of poor oral health increases the risk of diabetes, increased risk of heart disease. Outside of that, we can look at the respiratory illnesses. We see lung infection, we see asthma, pneumonia, we see chronic obstructive pulmonary disease. And it's important to note, these respiratory diseases, the fact that it can have a negative impact on our respiratory system, shows how it really plays into the entire way that COVID-19 impacts our body. We know that COVID-19 is critical in terms of it plays upon our respiratory system first and foremost. And so that connection between oral health and respiratory health is critical to our understanding of how COVID-19 can actually be prolonged or even extended in terms of the negative impact that it's having because of that connection between oral health and respiratory health or systemic health, which is our overall body's health. There was a research that showed that in many instances where a patient had poor oral health and they were on a ventilator, they actually were at higher risk for having lung infections, because when the ventilator is connected and there's a tube, an endotracheal tube, meaning it goes from the mouth into the trachea to connect to the lungs to bring oxygenated air into the lungs, we see that in many instances, because it passes the mouth and there's poor oral health, we have the negative bacteria, harmful bacteria, going along the tube and following down and having an impact on our lungs. We see lung infection being a critical component. So now, when we're considering oral health and maintaining your oral health with COVID-19 challenges that we can face through that, we have to look at it from the clinical or the dental perspective as well as the holistic perspective. With our dental patients, the first thing that we tell them is to follow the 2x2 rule, meaning ensure that you're brushing your teeth twice a day for at least 2 minutes at a time. We also recommend that they floss at least once a day and they ensure that they wash their hands so there's no cross-contamination of bacteria and dirt from their hands now to their mouth with the floss. They also have to keep their toothbrush clean and disinfected as much as possible, and they can also use a non-alcoholic mouthwash as well to reduce the bacterial and the viral load within their body or within their mouth primarily. From the aspect of oral health and nutrition, the holistic perspective, we do know that oral health is based on good nutrition. Good nutrition is essential for your body and all the systems to function. I believe that's basically it when it comes to what you can do to prevent, but there are tons of other factors that you could consider, and that will take us all day if we had the time. But again, thank you so much for giving me the opportunity to speak about this. I wish I had more time, but due to constraints on my end, unfortunately, we definitely have to come back to this. But thank you again, Mishka. Really appreciated being here. Thank you so much for the opportunity, and hopefully we connect again next time with more information with respect to oral health and wellness in general.
Well, Wade, it was an honor having you here, and I'm glad that you could be able to make it. Thank you so much for being able to come onto my video today. Thank you guys so much for watching, and I really hope you learned something today. If you like this video, just share it among your friends, give it a little like, and comment any questions that you might have. Now, remember, brush twice daily, floss, use your mouthwash, keep wearing your mask, wash your hands at all time, and you should be good for this pandemic. Thank you so much for coming this week, and I hope to see you guys next week again.